Hello everyone, my name is Jonathan Steven Andrade. I'm going to talk about catheterization on the urethra inguinal. I am a medicine student in UCSG University. Let's talk about first with the definition. Definition: a urinary catheterization of latex, polyurethane, or silicone tube known as a urinary catheter is inserted into the bladder through the urethra. Catheterization allows urine to drain from the bladder for collection. It may be also used to inject liquid used for treatment or diagnosis of bladder conditions. A clinician, often a nurse, usually performs the procedure, but self-catheterization is also possible. A catheter may be in place for a long period of time, in wheeling catheter, or removed after each use, intermittent catheterization. Let's continue with application in medicine. Application in medicine. Common indication for urinary catheterization include acute or chronic urinary retention, which can damage the kidney. Orthopedic procedures that may limit a patient's movement. The need for acute monitoring input and output, such as IUCU, benign prostatic hyperplasia, incontinence, and the effect of various circle intervention involving the bladder, prostate, or bowel.
The purpose of this video is to show how to anchor a catheter placed into the bladder. Proper anchoring of your catheter can reduce pain in the bladder and urethra caused from the catheter being pulled on or traction being placed on the catheter. Many anchoring devices are commercially available. A few of the many anchoring devices will be demonstrated in this video. Let's begin by starting up at the catheter. Traction on a catheter can be avoided by ensuring a loop or soft bend in the catheter is present between the point the catheter exits your body and the anchoring device. If you have a suprapubic catheter in place, it is important that the catheter be anchored on your abdomen a few inches from where the catheter comes out of your body. If your catheter exits your urethra, the catheter should be anchored on the abdomen or thigh. The location of the anchoring device is dependent on your body's characteristics and the length of the catheter exiting your body. If a urethroplasty was performed, the preferred location to anchor the catheter is on your abdomen. A Foley stabilization device allows the catheter to be anchored at the Y connection on the catheter. The mechanism allows the catheter to swivel. If hair is present, wet the skin and shave the direction the hair falls to prevent skin irritation. Apply the skin barrier film to allow the skin barrier to dry. Place the catheter into the Foley stabilization device and find the best location to place the device, ensuring a loop is present between the end of the catheter and the device. Secure the stabilization device to your body. Another anchoring device is an adhesive anchoring device. It can be used anywhere on the catheter or on the tubing of a leg bag or night drainage bag. Again, find a location which best fits your body. Place the foam adhesive side on your body. Remove the paper backing on the adhesive strip. Place the catheter or tubing into the adhesive strip, ensuring the catheter or tubing is secured on both sides of the catheter or tubing. If you secure the adhesive only on the outer aspect, the catheter can slip in the device. The adhesive anchoring device can be opened up multiple times to allow you to switch the location of the catheter or tubing. In some cases, both a Foley stabilization device and the adhesive anchoring device may be needed. Tape can also be used to secure a catheter tubing. Again, it is important to make sure tape is secured to tape both before and after the catheter or tubing to prevent slipping. A catheter is attached to leg bags and night drainage bags. It is important for the tubing on the leg bag or night bag be secured to your leg to prevent pulling on the catheter. Tape, an adhesive anchoring device, or a leg strap can be used to secure the tubing on the drainage bags. If a leg strap is used, secure the leg strap comfortably to your leg. Open up the green securing loops and secure the tubing in place. When using a leg bag, it is important that the leg straps be secured properly in place. The strap has a textured side to help the strap stay in place. Place the textured side against your skin. Adjust the length of the leg strap to fit your leg. Lock the strap into position by locking the strap in place. This will prevent the strap from getting longer as the bag fills with urine, causing pulling on the catheter.
Let's continue with pros and cons. Pros and cons. Catheterization can be a short or long-term complication. Generally, long-term catheterization carry higher risk or complication. Long-term catheterization carry a significant risk of urinary tract infection because of the risk catheterization or the last resort for the
Catheterization allows urine to drain freely from the bladder for collection. In your role, you may be required to change urinary catheters. But in order to do this, you need appropriate knowledge of the types of catheters and routes of catheterization. A urinary catheter is a hollow tube inserted into the bladder to drain urine. Urinary catheterization is the passage of a urinary catheter into the bladder via the urethra, which is called urethral or indwelling catheterization, or through the abdominal wall. This is called suprapubic catheterization. By following the correct procedures for changing urinary catheters and recognising how to monitor and troubleshoot, you can help preserve the comfort and dignity of the person in your care.
management of incontinence, where the other measure has proved and is successful. Other lung complications may include blood infection, sepsis, urethral injury, skin breakdown, bladder stone, and blood in the urinary hematuria. After many years catheter use, bladder cancer can be also developed. Let's continue with pros and cons. Pros and cons. Catheterization can be a short or long-term complication. Generally, long-term catheterization carry higher risk or complication. Long-term catheterization carry a significant risk of urinary tract infection because of the risk catheterization or the last resort for the management of incontinence, where the other measure has proved and is successful. Other lung complications may include blood infection, sepsis, urethral injury, skin breakdown, bladder stone, and blood in the urinary hematuria. After many years catheter use, bladder cancer can be also developed.
Hi, Dan Resnick from Pacific Northwest Urology, and today I'm going to be talking about how you can remove your Foley catheter at home. So after many different urological procedures, you may have a Foley catheter after the procedure. This is a catheter that drains your bladder into a bag. It may allow the urethra to heal, maybe there's some difficulty urinating, whatever the cause. Sometimes we send you home with the catheter and ask you to remove it yourself. The catheter has several different parts. Inside the body, this part, there's a balloon that holds the catheter in place and holds it in the bladder so the catheter does not get accidentally removed. And then the part that's sticking out that you see is oftentimes has two parts. One part here is where the catheter drains into a bag where the urine goes, and the other part here is a balloon port. The balloon port is what inflates this catheter. So oftentimes what we have you do when you go home is deflate the balloon and the catheter pulls out easily. There's two ways to do this. Either send you with a syringe where you can put a syringe in and remove the fluid from the balloon, and in this case, the fluid comes out. This is sterile water. I use air in demonstration for this video, but sterile water at home. The other way that you can do it is simply cut off this port right here. This is the simpler route and one I oftentimes suggest to men or women that have to remove the catheter at home, to go into the shower and simply cut off this part here, the balloon port. What will happen is about 10 or sometimes more cc's of sterile water will drain out. The balloon goes away and the catheter simply pulls out easily. If you have any questions or concerns, call your urologist or your physician, and they can explain that in more detail. Thanks for watching our video today. If you have any other questions, feel free to leave them in the comments below.
Conclusion. Urinary catheterization is a common intervention used by healthcare patients to manage urinary problems such as urinary retention and urinary incontinence. The common use of this intervention does not, however, imply that catheterization is without serious complications or is always used appropriately. And that's it. Thank you for your attention. Goodbye.